Oh, the bright lights. As I said to you, as a radio presenter, I'm used to being in a studio, and it's actually quite a lonely job. For 3 hours there I am playing songs and talking, and you just hope that actually someone is listening. Not only my mother, who'll send me a text message, but I said at the start, so it's for me, it's great to be out and about. But the bright lights, yeah, this is why I have to say I have painted face on today. My husband always says when I get home he gets mini me because like the extensions come out, the eyelashes come off, and there's a pile of mini Gina there. And then the specs go on, and there I am. So hurrah! So I made the effort for you guys today. So welcome back, and that was great. The first session, I really enjoyed listening to, of course, Principal and yourself. Of course, Dr. Anna. I've got so many questions, but let's move on for time. And thank you for the questions also that have come through as well. So I think we can move to Leigh Spanner now. So Leigh is responsible for overseeing the work of Student Minds, and of course what Student Minds does to engage with universities, student unions and other organisations. A responsible job. Leigh, welcome.
Hi there, you okay?
Oh, we may have gone on to silence again. Silence is golden. Can you hear me?
Can you hear me okay?
Yeah. Hey!
Excellent. Well, I can actually hear myself though, so that might get a bit distracting. If we can resolve that.
Oh yeah, I know. When you get that feedback in your ears, I often simply just call that internal dialogue anyway, which I try and switch off most of the time.
Brilliant. Oh, right, I think it's resolved now, so that's brilliant. And glad you can all hear and see me both on the Zoom and in the studio. Great that we can have these really cool hybrid events. And yeah, thanks to everybody at City Glasgow College for organising this. I know you've been working really hard behind the scenes in the lead up to the event and so on. And just hearing the previous two speakers and the people you're working with and the sheer passion you have for kind of making change, positive change in this area for students and staff as well. It's just incredible to hear about. So yeah, I guess as a way of an introduction, I'm Leigh Spanner. I'm a Sector Improvement Lead at Student Minds. So I head up two of our sector improvement programmes, which are the University Mental Health Charter, which I'm going to talk a bit about today and how that might apply in a college context as well. And one of our other programmes, which is Student Minds SUs, and we're actually in a session at the moment with some SU officers from around Scotland. They're having a bit of a peer support session as we speak, so that's really exciting. But yeah, okay, so a bit about Student Minds first. If we could have the next slide, please. And the next one again. Thank you. So if you're not aware of us, Student Minds, we are the UK's student mental health charity. And we work in a number of different ways. So we work with students on the ground. We run peer support groups and campaigning groups for students as well as delivering training for staff in SUs, in universities and in other organisations like accommodation providers. We lead our sector improvement programmes like the ones I've just mentioned there. And we work at that kind of national level doing research projects right across the country, looking at what are those kind of grand challenges that we're dealing with in student mental health, and also influencing policy at that national level where we can as well. Cool, have the next slide, please. So I'm going to first of all chat a bit about what we talk about when we mean, what do we mean when we talk about mental health and wellbeing? Because I think it's important that we kind of all get on the same page with some of these concepts first, and so we can understand what we're talking about. Before moving on to this concept of what we mean by a whole university approach or a whole college approach to supporting mental health and wellbeing, which is something that the University Mental Health Charter promote. So I'll talk a bit about the charter and what that says and how it outlines how we take that whole organisation approach to mental health and wellbeing as well. So first of all, in terms of mental health, what do we mean when we talk about mental health? So at Student Minds, there are loads of different definitions for mental health and wellbeing that you can use, and there's lots of debate and stuff around these, but some of these are just the ones that we use that are quite helpful. And so when we talk about mental health, we talk about it being a full spectrum of experience, ranging from good mental health to mental illness. So in that sense, it's really important to recognise that everybody does have mental health. So just like physical health, you have your mental health too. So when we talk about mental health, we're not just talking about those who have a diagnosed mental illness, but we're talking about everybody. And good mental health is when you're feeling good, you're responding appropriately and positively, contributing to the community, and it's an absence of illness. Poor mental health or mental health problems is where individuals start to experience levels of emotional or psychological distress that are beyond their ability to effectively manage. So not only is it important that we try to promote good mental health for everybody, it's also important that we ensure that there's effective support available for those that have poor mental health or mental health problems. Doing yoga for everybody isn't going to solve the problem for those who do have mental health problems or mental health illness as well. Could I have the next slide, please? Cool. And this is another model we tend to use when talking about mental health and wellbeing. Again, other models are available, and there's lots of debate about these and what they mean, but this can be quite helpful in some ways. So as you can see here, it's got mental health is there, and that's on a continuum on that axis there, from mental health difficulties to good mental health. And what we've got on the other axis there is well-being, which is something that's quite different. And it's really important to understand that they're being different things, but also interrelated. And it's important because you can see here that even if you're someone with good mental health, you may also have days where you feel unable to cope, you feel a bit stressed and have low mood, or you might withdraw from social situations. And that's completely normal. Everybody has those days. It doesn't mean that you've got a mental health difficulty necessarily, unless that continues to become a normal experience and it becomes more difficult to manage over the long term. And it also means that those with poor mental health, they can have good periods where they're managing their mental health well, and they've got a really good support network around them, and yeah, they're feeling okay most of the time. So it doesn't mean that, if you've got a mental health diagnosis, that you're necessarily struggling at all times either. So again, this just shows that everybody sits along the continuum somewhere, and you can move along this in your lifetime. You can move up and down the wellbeing one hour by hour, day by day, So when we're thinking about mental health and wellbeing and what our role is in playing in that, it's to promote good mental health and wellbeing, but also to ensure that those mental health difficulties and poor mental health have that necessary support available to them. Could I have the next slide, please? So a bit about the University Mental Health Charter and why we decided to create one, I guess. Could I have the next slide, please? So lots of facts and stats here. I'm not going to go into them all in detail, but this basically just shows that we knew that even prior to the pandemic, the prevalence and complexity of mental health problems in the student population was on the increase. And the bottom line is just far too many students were taking their own lives. And this still applies to staff. We also see an increase in staff seeking support from occupational health and so on as well, and concerns about their well-being and the pressures of working life on them. And obviously with the pandemic, we'll talk about this in a second, but we've only seen that seemingly get worse. Both young people and students have been highlighted as being particularly impacted by the pandemic in terms of their mental health and well-being. And we don't know what the kind of long-term impacts are going to be, but they're likely to continue. Could I have the next slide, please? Cool. So I guess prior, when we started to create the charter, a lot of the national discussion around mental health in universities was how do we respond to mental illness? And although an absence of illness is absolutely a valid thing to strive for, and we should all obviously strive for that, and it's important, it's potentially not enough. We know that universities can be good for the mental health of all of our communities, of our staff and students, the places where we can be creative, we can be challenged, and we know that graduates have better mental health and well-being often, and different outcomes to those who don't go to university. So there's so much potential there. Why are we not striving for everybody to have the best experience they possibly can? So that's kind of the approach of the charter. Have the next slide, please. Cool. So the kind of point of the charter is to support all universities to adopt a whole university approach to mental health and well-being. Just on the screen. Of all members of the university community. So we're talking about staff and students as well. And there are three main elements to the University Mental Health Charter. So there's the evidence-informed framework that we produce that provides a reference point for universities to adopt the whole university approach to mental health and well-being. And that was developed over a year-long research period with thousands of staff and students right across the UK, coming to feed into focus groups and surveys and so on, and really co-produce and shape that framework together. We've also got a programme for universities where it's really bringing them together as a community practice to start to work towards the principles within that framework, improve their approach and share practice. And then hopefully those that are on the programme can work towards a voluntary accreditation scheme which will encourage them to continually improve their approach and also recognise where there's excellent practice, because we know there's excellent practice in the sector. There's some absolutely amazing case studies and things that we've seen throughout the development of this process. And start to build an evidence base for that. You know, where are we collecting and storing these, you know, really good examples of practice that can be shared across the sector, and supporting others to improve on top of that as well. The next slide, please. And the next one. So I guess a bit on this idea of a whole university approach, or a whole college approach, or a whole organisation approach, if you will. They are interchangeable. So it's about students and staff. And the evidence behind this is because the evidence shows that every aspect of our environment can have an impact on our mental health and well-being, whether that's positive or negative. So our physical, cultural, social and personal environments. So what this means is actually universities and colleges, they already have a whole university impact on mental health and well-being. Whether that's positive, intentional or unintentional, it's already happening. So I guess the point of the whole university approach, or the whole college approach, is that to set out a way in which we can have a conscious, intentional, positive impact on the mental health and well-being of our staff and students. Next slide, please. And the next one. Cool. All right, so these are the kind of four main elements of the University Mental Health Charter, and what we talk about when we talk about that whole organisation approach to mental health and wellbeing. It's mapped onto the Universities UK Step Change Framework, which some of you may be familiar with before as well. And I'm just going to touch on each of these elements. We're not going to do a deep dive today, just to kind of introduce you to some of the concepts. So as we were saying before, that support is a massive part of this. Some people think if we take that more preventative, holistic approach, that's going to draw resources away from support services, and that's just not true. Support services for staff and students are absolutely core to this. They need to be safe, effective, accessible, well-governed and appropriate to context. And a lot of what that means is, yes, they probably do need more resource to be able to do that. We know that the demand for these services is outstripping supply at the moment across a lot of organisations, and that needs to change in order for students to have the support that they need when things go wrong and they start to suffer from mental health problems. Then learn is the next important one, I think, because this is all about the learning environment, and where this comes from is no matter what kind of educational organisation you are and what your student makeup is, whether they're part-time distance learning, vocational, working on the job or placement students, that kind of thing, whatever type of student you have, the only guaranteed point of contact between students and their university is through the curriculum. So of course that's a core aspect of how we achieve that whole university approach. And as Dr. Anna James outlined there, some really good ideas about how we can help students through the curriculum build in and develop some of those resilient skills, those wellbeing skills, how to maintain and manage their own mental health and wellbeing. But it's also about just structuring the curriculum and the process so students can acquire the knowledge, skills and confidence to succeed at an appropriate pace for them. And you know, some of that is just really good inclusive pedagogy. If you think about it, if a student's struggling because the deadlines are all piled up into 1 week, and you know, you take that struggling student, you say go to the counselling service, you risk their pathologising what's a very normal reaction to a very difficult pressurised situation that student's under. And maybe it's thinking just differently about some of those situations that students are in. Are the things that the college is doing that can impact negatively on the mental health and wellbeing that isn't necessary? And you know, how can we adjust that and take that away? And that's not about dumbing down our curriculum or our work, making it really easy for students, because also what the evidence says is that challenge can be really good for students. That kind of idea of flow, the flow state that you can get in, is kind of something that we should all strive for. And that's a real good balance between something that's really challenging and really interesting for your learning, but there's a sense of ease there as well, in which it's not becoming too difficult or stressful for you in that situation. And it's great to see from listening to Anna James there, the great toolkit that City of Glasgow College has been working with her on to develop, and yeah, really excited to hear more about that. And another key part of this is the kind of transition into university. So we know that transition is a really key risk time. You know, it's a time when students are going through a lot of change in their living situation, in their learning environment. And we know that when students have a really positive transition experience into the university, then this can be absolutely a massive protective factor in their mental health and well-being. They're going to go on to potentially, you know, have better mental health and well-being because of that. But if they have a negative transition experience, that can be a real risk point for them, and they can go on to, you know, have a lower sense of well-being and developing mental health problems in the long term. So it's great to see as well that City of Glasgow College are implementing some different interventions. So like the digital support that you provide for students on pre-arrival into university can really help set them up in things like that. For oh, sorry, I just heard myself. Oh, I'm back on. Okay, cool. And yeah, so that's a really good initiative there. Next is the work domain. So this is all about staff mental health and well-being in itself and staff development. So we know, of course, staff mental health must be a priority in itself. So often there's this misconception that to prioritise student mental health and well-being, we have to deprioritise staff mental health and well-being. And actually the evidence shows that they're massively interrelated, so need to work together. So when staff are overworked and you know, they don't have the time to respond to students when they're struggling or approach them with a concern or something, that can have a real big impact on that student. And also we know that staff are often affected in terms of their mental health and well-being when they're continually being approached by students who are having troubles with their mental health and well-being, and they're not equipped to respond appropriately, and that can be a real significant impact on them. And I think it's really important because most student-facing staff, it's almost guaranteed that at some point you'll have to deal with a student with some form of mental health and well-being concern, or it might be dressed up as, you know, it's a financial worry or something like that, where your initial reaction can actually have a big impact on their lives. And it doesn't mean that staff have to become counsellors in any respect. That's another thing, you know, saying that support services role, not mine, I do the curriculum, and that would be absolutely inappropriate for staff to take on that support role where they are not qualified to do so. But it's about ensuring that staff are equipped to understand how to respond in a way that's safe for the student, ensures that they can get the right support, but also that staff can be equipped to maintain those professional boundaries of their particular role. This is the amount of support I can provide, and this is where it ends, and being able to communicate that effectively, so that that they can protect their own mental health and well-being and feel safe in that context as well. And then the last one is live. So this is about the whole environment, the kind of, so it's about providing proactive interventions, you know, thinking about things like physical health and those kind of things, and not just reactive support, but how we're implementing things that help people maintain healthy behaviours and healthy lifestyles. And also about the context and culture and where staff and students study and live. Is there a culture that promotes them to be open about their mental health and well-being, to seek support when it's needed, and to feel positive? Yeah, is there an environment such as a physical environment is another thing that the chapter picks up on. Is it allowing staff and students to feel like they're in a space that's conducive to effective work, or if they're in accommodation, to sleep, which is so important to mental health and well-being as well. Okay, and then the last is kind of cutting across through all of those in the ring there are some enabling themes that the chapter picks up on. So this talks about the kind of role of leadership, which is really important to ensuring that staff and students have the resources that they need to create this positive change. Cohesive working between services, you know, our academic teams talking to support services teams, are those referral pathways working as they should be. And another one I want to highlight is student co-production. So involving students in the design of mental health strategies, policies, processes, services, as well as the curriculum, and other aspects of their university experience. And we know that involving end users in services actually improves outcomes for students or for the end users as well. And I think it's particularly important now in this context of a pandemic, that despite everybody here may have had some experience of being a student in the past, nobody here that works in the higher education sector has ever experienced being a student in a pandemic. So it's absolutely important that we now listen to students and understand what their experience is, what their needs are, and how they're different to students that have come before them. And I think Scotland have actually got a really good basis from this, and through all the research we've done across the UK. Obviously, Scotland have got the Think Positive programme with NUS, and my colleague might talk about this after myself. And that's just incredible that students through that programme are being, enabled to work, encouraged to work with their universities right at that top strategic level, thinking about across the whole university what a student's prioritising needs to be changed to improve their mental health and well-being. So I just think that's incredible and a really good basis. And it's thinking about how does that trickle down into everything else you do? How are we ensuring we're involving students and listening to their needs as well? Cool, I'll be very quick on the next couple of slides, and just the next slide again. So we've got some research findings that we've been doing at Student Minds around the pandemic. So again, some facts and stats that we might be able to share these slides so you can have a look at them in detail. But obviously the mental health and wellbeing of students has been massively impacted by the pandemic. They felt lonely and isolated. This was around April and May of this year. And then if you go on to the next slide, we redid this study in September 2021, and although we can see some improvements, we know that there's still massive barriers to support, and there's continuing challenges with their mental health and wellbeing as well. So thinking about the barriers to them disclosing their mental health and wellbeing, not feeling like it's serious enough was something that students kept raising. Because everybody's been through this pandemic, so why should my struggles matter? That's something that was really interesting that came through there. And there's a big proportion of students that don't feel they have that confidence academically to take that next step. So how is that going to affect their preparedness in coming into this new year? Cool. All right. So I guess that just proves that more than ever, we need to come together to think about mental health and wellbeing, not just about delivering counselling services, but about it being everybody's responsibility, and how can we embed this in everything that the college or the higher education institution does. And it's a real opportunity as well, I think, and not to get too worried about some of the facts and stats that the pandemic's brought, because through conversations with staff and students over the past few years, we've really found, a massively enhanced enthusiasm for mental health and wellbeing. And people get it now. They understand that this is important, and it's just about now what do we do? And there's been some incredible practice just in terms of our reframing of how we think about education and our workspaces. We tend to be more inclusive. We've understood flexible ways of working because we've had to. So how do we kind of capture that learning?
Oh, just at the key moment. Hanging on to everyone there. Leigh, not sure.
And that's great to see. It's that continuation of some of the positives that we've gained from this experience as well could be really useful. So in terms of next steps for the charter, so we've got 41 universities have signed up to it onto the programme this year, and we hope to continue to grow that with some more Scottish institutions and things like that as well in the future. It's not currently available for HE and FE spaces. I think that was just ensuring that we were focusing on one area of the sector initially, and then hopefully one day we'll be able to do a pilot with colleges to understand how their kind of context might be a bit unique, and how we might be able to develop an assessment process that works specifically for colleges in their context as well. So hopefully that will come in the future. But in the meantime, I'm sure the actual University Mental Health Charter document will be really useful to read, and there's a lot there that might apply or be useful to your practice as well. A couple of slides on, please. And the next one. And the next one. Well, Okay, so I'm not going to be able to stay for the panel, unfortunately, but absolutely happy to continue the conversation however we can. If you've got any questions, particularly for me, do let the organisers know, and they can pass that on to me, or email directly at charter@studentminds.org.uk. And do visit the site as well. There's some really cool stuff on there and resources that link to all those areas that I've just talked about that whole institution approach to mental health and wellbeing. But yeah, that's all from me. So nothing more to say other than thank you for having me and bearing with the initial technical issues. And it's been great to hear about the work that you've been doing. All the best for the future.
Wow, wasn't she amazing? Thank you, Leigh Spanner. She sounds like a lovely girl. You could quite easily chat her office and got time for a cup of tea, a quick chat. Listen to her. And it was interesting that she picked up, Dr. Anna, on what you said about being very careful where you may have a normal reaction to something that's a stressful situation, but not to turn it into a problem. And then before you know it, you have something which has been blown out of context. I always think that my EQ is like higher than my IQ. I wish certainly when I studied many years ago, I had access, to all of this as opposed to learning or investing in myself. What does it say? The best investment you can make is in yourself along the way. And just very quickly, 10 seconds for you guys, is that talking about normalising things, I went through this stressful situation a long time ago where I had a sleep problem. So I always have to get the best. So I figured out I'd go and see this guy called Professor Espy, who is an amazing chap and well known in his field for people with sleep problems. So it was supposed to be a 12-week programme, right? So I go and I sit down and I start to talk about my stuff. And he says, okay, let's break it all down. So if you're in a car, where are you in the car? And I said, well, I'm driving, obviously, like attitude problem. I only lasted one session, let me tell you. One session, and that was that. And I gave him my feedback, and he gave me his feedback too. And he recommended 2 books, The Psychopath Test, John Ronson, and also How to Fall Asleep Without Counting Sheep. What was he trying to tell me? I don't know. The first book, amazing. I started diagnosing people. I'm like, psychopath, she's one, he's one. And then the How to Fall Asleep Without Counting Sheep. Oh my God, is the most boring book you will ever read in your life. After that, guess what? My sleep problem was resolved. Amen. Right, let's move on to Alex